Hi, I'm Sarah Diersing, and I'm one of the post-transplant coordinators on the UC Health transplant team. After discharge from the hospital, you will have many things you need to do to care for yourself and your new liver. You will need to attend follow-up appointments in the transplant clinic as instructed. You'll need to have your blood test drawn routinely as instructed. We'll ask you to monitor and record your weight, vital signs, and blood sugars every day. You'll need to limit your activity during the early post-transplant period and schedule routine health screenings with your primary care doctor and other providers as recommended. It's important to avoid behaviors that lead to health concerns and complications after liver transplant. Please maintain regular contact with your transplant team through your nurse coordinator to avoid complications and ensure continued recovery after liver transplant. This video will review these topics in detail. After discharge from the hospital, you will be seen at least once a week in the transplant clinic. Usually patients are seen weekly for the first month, then every other week, and then less frequently as they recover. You will need to bring the following items with you to every clinic appointment: your medication card, your medications you need to take for the day, and your liver handbook. Your daily log is something you also need to bring. That is a record of your weights, your blood pressure measurements, your pulse measurements, daily temperatures, and blood sugars. It's also important that a family member or caregiver come with you to your clinic appointment. Your medical care after transplant can be overwhelming, and most patients do best when they have a caregiver to assist them with medications, monitoring and recording vital signs, monitoring wound healing, monitoring for complications, communicating with the transplant team, and transportation to all medical appointments. As you improve, you will be able to manage your own care and no longer need the 24/7 assistance of your caregiver. During the clinic visit, you will be seen by many members of the transplant team, including a transplant physician, a nurse coordinator, pharmacist, and other members as needed, such as a social worker, a clinical nurse specialist, a dietitian, and financial coordinator. During the visit, you will be examined. Your lab results, medication card, and your daily log will be reviewed. Based on this information, your plan of care is determined, and any changes in care, medications, or the need to schedule additional procedures or tests are discussed with you. You will also have the opportunity to ask questions and discuss any concerns. Let's talk about blood tests. Monitoring blood tests is another way your transplant team follows your recovery and checks how your new liver and other important body systems are functioning. These are examples of blood tests that are commonly monitored after transplant. The hepatic panel. This is a blood test that monitors your liver function. This blood test checks how well your new liver is working, and it also watches for any signs of rejection, infection, and/or blockage of the bile ducts. Another blood test is a renal panel. This test monitors kidney function, electrolytes, and fluid balance. Anti-rejection medications can sometimes affect how well your kidneys work, so it's important that kidney function tests are checked regularly. If your kidneys are not working well, you may also have abnormal electrolyte levels. Your transplant team may need to make adjustments to your anti-rejection medications and/or other medications based on your kidney function. Another blood test is a complete blood count with differential, or a CBC with diff. This will be monitored with your routine labs to check for infection, the effects of anti-rejection medications, monitor for anemia, which is a low red blood cell count, and to make sure you have the normal range of each type of blood cell. Drug levels will also be monitored to determine how much drug is in your blood. For example, this is done for the immunosuppressant medication tacrolimus or Prograf, since your dosage will be determined by the level of prograf or tacrolimus in your blood. Blood tests are done frequently after transplant to monitor your recovery and progress. As you improve, your blood tests will be checked less often. Your blood tests may be repeated more frequently if you have rejection, infection, recent changes in your medications, or other complications. When you return home, you will have your blood test done locally or by a home care nurse. It is your responsibility to make arrangements at a local lab for your blood tests. Your coordinator will provide you with lab orders, instructions on when to have them done, and how to have your results sent to the transplant center. Your coordinator will also review your results and call you only if your test results are out of the normal range and/or medications need to be adjusted. Some abnormal lab values may be acceptable as you recover from transplant or a related complication, and those should improve over time. Your coordinator will give you written instructions on how to set up an internet account to access your lab results at your first clinic visit. If you prefer, you may also call your coordinator at any time to be sure your results have been reviewed and to discuss any questions or concerns you might have. Your vital signs. When you leave the hospital, you will be instructed to monitor and record your weight, temperature, pulse, blood pressure, and blood sugars every day. These are your vital signs. It is your responsibility to record your vital signs in the daily log, which will be provided for you. Please be sure to bring your daily log with you to your transplant appointments. It will assist your transplant team in monitoring your progress. If you experience difficulty breathing or any chest pain or pressure after transplant, please call Emergency Services 911 and ask to be taken to the nearest emergency room. Never try to drive yourself or have a caregiver take you to the hospital because you may require care as soon as possible. Please call your transplant coordinator to report all emergency visits or admissions to the hospital. Blood pressure is the measure of force in your arteries. It is a measure of two types of pressure, the systolic and the diastolic. The blood pressure measurement is written as two numbers. For example, 120/80. The systolic blood pressure is the top number, and this measures the force of muscle contraction of the heart as blood is pumped out of the chambers of the heart. The diastolic blood pressure is the bottom number and is when the heart muscle is at rest between beats, expanding and filling with blood. Before discharging home from the hospital, know what your normal blood pressure range is. Once you are home, you need to take your blood pressure every morning and every evening at about the same time using the same arm. Even if your blood pressure is normal, you still need to take it twice a day as instructed. Please call your transplant coordinator if your blood pressure is greater than or less than the parameters they instruct for you. Record your blood pressure on your daily log and bring the daily log to every clinic appointment. If needed, your inpatient transplant team will provide you with a prescription for a blood pressure cuff, or you can purchase one from your local pharmacy. Cuffs may be manual, you pump them up yourself, or digital, which is automatic. We recommend a digital cuff as it is easier to use. High blood pressure is also called hypertension, and that may occur early on after liver transplant and is often related to side effects of some medications or kidney problems. It can usually be managed well with blood pressure medications and/or some changes in your diet. Temperature. Normal body temperature is 98.6 degrees Fahrenheit. If your temperature is rising, you may feel hot or cold, achy, and you may develop chills or sweat. Fever is an important symptom and it can occur with rejection or infection. Please monitor and record your temperature on your daily log every morning and every evening and whenever you feel sick. Call your transplant coordinator or physician if your temperature is equal to or greater than 101 degrees Fahrenheit, or if your temperature is greater than or equal to 100 degrees Fahrenheit for 24 hours or more. Do not take Tylenol or any other medications unless instructed by your transplant coordinator or physician. Your pulse rate is the number of times your heart beats in a minute. For example, 72 beats per minute. Your pulse can be felt in your wrist or neck. Please take your pulse when you take your blood pressure twice daily, or if you feel like your heart is beating too fast or racing, and record it on your daily log. Know what your normal pulse rate range is when you are at rest and when you are active. Discuss with your coordinator the pulse ranges that are too low or too high, and when to call your transplant coordinator. It's important to weigh yourself every day after transplant. Please check your weight on the same scale at the same time with the same amount of clothing each morning. After you go to the bathroom, but before you eat breakfast is a good time. Please record your weight on the daily log. This will help your transplant team follow any changes in your weight. Gaining or losing weight, particularly if this happens suddenly, can be a sign of problems in your recovery. A sudden weight gain could mean that you are holding in fluids. This could be a side effect of medications or a sign that your kidneys are not working well. A sudden loss could mean you are dehydrated, which can be harmful to your heart and kidneys. Call your transplant coordinator with any sudden weight changes. Know your weight at discharge from the hospital, and call your transplant coordinator if you have a sudden weight gain of greater than 5 pounds.